my name is Carly Brolon. I'm going to be your advanced practice nurse practitioner today. It is 10:31. It's about 7 o'clock at night. I'm just going to do a quick health history with you. Just ask you a couple yes and no questions. Just kind of get some basis on your family and your own health history so that we know how to better take care of you in your future, okay?
Okay.
All right, I'm going to start off just asking your name.
Chase Kovacs,
Okay, and what age are you?
25.
And are you a male or a female?
Male.
Okay, and your race?
Caucasian.
Okay, and your past medical history, were you ever ill as a child?
No.
No hospitalizations, chronic illnesses
Nope.
that you know of? All right, and did you get all of your immunizations when you were a child?
Yes.
Did you get your flu and COVID vaccine this year?
No.
Okay, perfect. If you want to schedule those later, we can. Have you ever had any surgeries in the past?
Yes.
Okay, what were your surgeries?
I had a hernia when I was a baby.
All right, and that was all taken care of at a young age? Were you less than 3 years old?
Yes. 3 months, I believe, or 3 weeks. 3
Okay.
weeks, yeah.
Any other surgeries since then?
Nope.
Any injuries that you've had?
Nothing jumps out now.
Okay, no disabilities or other limitations?
Mm-hmm.
You have full range of motions of all your extremities?
Mm-hmm.
Okay. Do you currently take any medications?
No.
And do you have any allergies to medicine or environmental factors?
Bee stings and the medicine C-chlor.
Okay, good to know. Thank you. Have you ever had a blood transfusion in the past?
No.
All right. And have you ever had any recent screening for like an MRI, a CAT scan, a CT?
I had a MRI on my knee and a CAT scan on my head after a minor head injury.
Okay. How long ago would you say that was?
The CT scan?
Mm-hmm.
Probably 2 years.
All right. Okay. And emotionally, how have you been feeling? Do you have any thoughts of harming yourself, others?
No.
Okay.
A little bit depressed, but you know, everybody goes through that.
Mm-hmm. You have a good support system?
I do, yes.
Good. Good to know. Okay, so as far as your family history, can you kind of walk me through your family tree? How many siblings do you have, mother, father?
2 younger sisters, mom and dad, my grandma and grandpa on mom's side. My grandma had a aortic dissection and has blood pressure issues. My grandma on my father's side has had multiple strokes. My dad has hypertension, and my mom has feet and back problems.
Okay, that's all good things to know. Just to let you know, cardiovascular disease does run in family trees, so
Okay.
we're going to want to watch out for that in the future. And did your grandparents or your parents any history of cancer in the family?
No, I'm sorry. No,
Okay.
not in the immediate family.
Any tuberculosis that you know of?
Nope.
Epilepsy? Cystic fibrosis?
No.
Diabetes?
No.
Okay. Kidney disease?
No.
Thyroid disease?
Nope.
All right. What about any like asthma, arthritis?
COPD.
Okay.
On dad's side.
All right. And any hearing or visual?
Hearing problems on mom's side.
Okay. All right. Perfect. And any genetic disorders that they have? That could be like cerebral palsy or anything along those lines.
Mm-hmm.
Okay. And are all of your grandparents still living?
No, just my grandma's are.
Okay. And their cause of death and when they died, do you know those by any chance?
Grandfather's cause of death was on my dad's side was leukemia, cancer, and on my mom's side was accidental workplace injury.
Okay. Do you know how old they were when they passed?
Grandfather on dad's side was 76, I believe, and my grandfather on mother's side was 51 when he died.
I'm so sorry to hear that. That's terrible. As far as your own personal and cultural background, I know you said you have good support systems, so your family structure is you all live in one cohesive home, correct? Mom and dad aren't divorced, split up.
Nope.
That's good. Any sort of stress that causes some, I don't want to say that it causes you to not be able to operate well, but anything that gets in the way of work, family.
No, nothing like that.
All right. Education. What's the highest level of education you've completed?
High school.
All right. And you would consider yourself to be in good economic status right now?
Fair. Yeah.
Okay. Do you live alone or do you live with your parents or?
I live alone.
Okay. And as far as your habits go, do you have any do you smoke tobacco, drink alcohol, any of the above?
Yes, I drink, smoke on occasion,
Okay.
but use tobacco products daily.
Okay, and is that chewing tobacco?
Yes.
Okay, perfect. How much would you say you average a week?
A week?
Mhm.
Oh, probably about 7 cans a week.
Okay, have you ever tried to quit?
Yeah, a couple times.
Okay, any intentions of quitting right now?
No.
Okay, that's fine. If you ever need to, we have definitely a lot of programs that could help you though.
Okay.
As far as self-care, you do your own grooming and everything, I'm assuming. You don't need any help with getting groceries,
No.
cutting your grass,
Nope.
none of the above. All right, and your home conditions, you would consider yourself that you live in a good neighborhood, you feel safe at home. And what is your occupation?
I'm a firefighter.
Okay, and where do you work?
Youngstown Fire Department.
All right. I know there's some health risks being a firefighter. Do you feel like you have the proper equipment at your workplace for your job?
At my workplace, no. I feel like we don't have the proper equipment often. And we actually we have to supply a lot of the things like personal protective gear ourselves.
Oh, wow.
Mm-hmm. So.
Be very careful. Smoke inhalation is not good for you. You've never been in the military.
No.
Any religious beliefs? Are you practicing Catholic, Christian?
Catholic.
Okay, perfect. And you have access to care. Do you have a primary care physician other than myself that you see?
Yes.
All right, and any special needs that you know of?
Nope.
Alrighty. As far as your just general health right now, you have any fever, chills, tiredness, fatigue more than the usual?
Uh-oh.
Any night sweats?
No.
How's your sleep pattern? What's that looking like?
I would say I'd average 5 hours a night. Sometimes a little bit less, rarely more than 5 or 6.
Can you function well on that?
Yeah, it's been doing that for a while.
Okay. And any super crazy changes in your weight loss or gain that you've noticed in the past couple months or so?
No, I would say gradual gain in weight over the last year due to schedule.
Gotcha. No differences in your hair, skin, nails, no excessive growth or anything?
Nope.
Any dizziness, head trauma recently?
No.
Syncope?
No.
Collapse? All right. Any unusual discharge from your eyes, glaucoma, any of those problems?
Mm-hmm.
You don't use eye drops,
No.
correct? All right. Do you wear contacts?
Yes.
Okay. And do you have glasses as well?
Yes.
All right. You're going to want to take those out while you sleep. Change those monthly.
Mm-hmm.
Good to know. Any sort of tinnitus, ringing in your ears, vertigo? I know you said your mom had some.
Yeah, she has hearing loss.
problems.
She wears hearing aids. But it's not from anything. She's just always had bad ears, and it's just gotten worse and worse over the years.
Gotcha.
So she uses hearing aids.
You don't notice any differences in your hearing though?
No.
Everything's
No.
still good? All right. And as far as you ever notice any lumps in your neck other than with it accompanying an illness?
No.
Okay. Any shortness of breath or a constant cough or anything of that nature?
Mm-mm.
All right. Pain with breathing?
No.
And I know you said you've had x-rays in the past. Have you ever had a chest x-ray?
I have, yes.
Okay, I'm assuming probably something that had to deal with being a firefighter.
Yes, I had to get a chest x-ray to become employed for the fire department.
Okay.
They demanded chest x-ray.
And that was unremarkable?
Yeah,
Nothing
that's
crazy.
what they said on Remarkable.
Perfect. Do you do self-exams as well as, I know that it's awkward, but men can also get breast cancer. So do you do monthly screenings for testicular and breast
Yes,
cancer?
absolutely.
Perfect. And do you have any chest pain, palpitations, edema in your lower extremities?
Nope.
No history of myocardial infarction or hypertension or anything?
Nope.
Have you ever had an EKG done?
No.
Okay. Any sort of clots? Has anyone ever told you you had a blood clot? Never been on any blood thinners?
Nope.
Perfect. Just a couple more things to go through. You said your diet just has been fluctuating with your schedule. Any sort of ulcers or constipation, diabetes, hemorrhoids?
Nope.
All right. Any changes in your stools recently?
Mm-mm.
Everything's pretty regular for you. All right. And you feel like your appetite hasn't changed. Do you take any sort of vitamins or supplements?
No.
No iron pills or anything of that nature? All right. And any sort of thyroid enlargement, heat or cold intolerance? You notice an increase in eating or drinking,
Mm-mm.
excessive thirst? All right. That would be some signs of diabetes. So we just want to keep check on that. I know you don't have a family history of it, but and as well as, you know, your own personal private areas, everything's okay down there. You're having regular erections and ejaculations, nothing out of the normal.
Mm-mm.
No signs of infertility with you.
Nope.
Okay. And have you noticed any differences in like your gait, any restrictions on your arm movement or your leg movement?
No.
No previous psych history, correct?
Nope.
No depression or anxiety?
No, ma'am.
Okay. And last thing that I'm going to ask, have you ever noticed any differences in your memory, weakness that's unexplained?
Mm-mm.
Okay. Well, I think we got about all the information we need. I'm going to get that in the computer, and then we'll be seeing you for your physical soon, okay?
Okay, sounds good.
Thank you so much for coming in today.
Great to meet you.